Welcome to Invest Insights. I'm Abby Melone. I'm joined today by Dan Tropeano, the CEO of UnitedHealthcare of Pennsylvania and Delaware. He joins us for our discussion on the COVID-19 pandemic. Don't forget to like this video and subscribe to our channel to watch more insights like this. Dan, UnitedHealthcare is providing over $1.5 billion of additional supports for its customers. Please speak to us about this initiative and how it will benefit the local customers in Pennsylvania and Delaware.
Well, first, thank you for having me. It's a pleasure being with you today. And thanks for bringing that question to the forefront. Yes, UnitedHealthcare has and is returning about $1.5 billion in premiums as well as payments to our customers, not only our commercial members who work for employers, but also to our Medicare and Medicaid customers. We're doing that for our commercial members in the forms of a premium refund, which they should be hitting their accounts in July, anywhere from 5 to 20%, depending on the customer or the products they have and where they're located. We're also returning that to our Medicare members in the form of enhanced benefits. So we'll be waiving copays and other cost-sharing items of our Medicare members' plans through September in order to help them out. And then also to our Medicaid members in forms of community support. And one example of that is, and it was just announced this morning, that we will be providing $750,000 of support here in Pennsylvania to help for COVID relief and PPE supplies in our Medicare community.
Wonderful. What has this crisis revealed about the possibilities of and potential of telemedicine? How have you already been implementing it, and what might the future post-COVID look like?
Yeah, so that's been one of the amazing things that's come from these challenges. At UnitedHealthcare, we were well down the virtual visit telehealth path. We've had those capabilities for our members and supplied those services to our members for multiple years now. And I believe due to the crisis, it's really just kind of pushed ahead the timing of members leveraging those services. So just some quick numbers. I mean, before the crisis, we were averaging about 80,000 visits or calls a month. That's across the country for our entire population. That was February. In March, that increased to 728,000. And in April, that increased to over 1.1 million. So you could see the amazing increase. Right here in Pennsylvania, in February, we had about 1,200. In March, over 12,000. And in April, over 24,000. So massive expansion, but not only in our commercial membership for those that work for employers, but in areas that traditionally were very low, like our Medicare members. So seniors as well as others are all picking up on the benefits and the access that's being provided.
That's wonderful. You know, on another side, this crisis has shown some light on many of the positive, but also the negative aspects of our healthcare system. How do you think that the industry might be reshaped when we are passing through this time?
Well, I think one of the positives or one of the things that are going to become about is not only virtual visits and telehealth, but virtually gaining access to the healthcare system, not only for services from a provider, but for customer service, for customer questions and things of that sort. These are capabilities that many of the carriers and payers out there have had traditionally, but they're being leveraged more, and more importantly, they're being enhanced, especially in areas like mental health. So one of the areas that the country lacks appropriate amount of coverage for is mental health and entrance into the mental health system. And we're now using technology, things like virtual visits and telehealth, to begin to leverage mental health services for the much needed mental health services that our members and the communities need.
I don't think Mental Health Awareness Month could have come at a better time.
Absolutely.
Pennsylvania is moving from the red zone to the yellow zone to the green zone in pockets in various counties. How is UnitedHealthcare working with local municipalities, counties, and the state in the reopening phase?
I have to tell you, at least in Pennsylvania, the regulators and government have been very responsive to our needs as payers. They've been extremely flexible in working with us so we can get care and coverage quickly into the hands of our members and clients and constituents. They've been fantastic. We've had regular calls with them and regular discussions with them in order to answer any concerns and issues. We are working with them in areas of data and information around what's going on with the virus and helping them with that information, as well as providing our talent. So a good example is Andrew Whitty, who was the president of our Optum unit, has left the organization for a short time to work with the World Health Organization to help lead those efforts around finding a virus vaccine and then talking about how to distribute it. Right here locally, we've provided 2 leaders to the state of New Jersey to help set up the field hospitals that they've set up in several locations. So that's how we're helping government and working with government to better provide support not only to our members, but to all of the citizens of the state of Pennsylvania.
And community engagement is so important. And should our viewers want to find out more information about UnitedHealthcare of Pennsylvania and Delaware, where would you direct them?
2 sites. One is unitedhealthgroup.com/newsroom, and that'll typically have the most up-to-date activities and news of the moment, or to our site specifically dedicated to COVID activities, uhc.com/COVID-19.
Wonderful. Well, thank you again. That was Dan Tropeano, the CEO of UnitedHealthcare of Pennsylvania and Delaware. My name is Abby Melone. Don't forget to like this video and subscribe to our channel for more information. This has been Invest Insights. Thank you.